The college has provided a bit of information here, and this is just 2 slides that I wanted to share with you because this is the kind of support materials that are being provided. And I think it's good for us to look at that as far as how we can guide the registrars. So it's talking, for example, under the competency of communication and consultation skills. It says common errors include inappropriate language, lack of empathy, formulaic approach, paternalistic or instructional approach, and awkward communication. So it's quite self-explanatory, I suppose, and quite intuitive. If you look at the clinical competency for communication and consultation skills, these are the kind of things you'd expect to see in a student who performs poorly. Similarly, in the competency, information gathering and interpretation, these are the common pitfalls, including chaotic and ineffective history taking, a history that's too long and detailed, not necessarily focused on the point, an examination similarly that's formulaic or too detailed and not focusing on the working diagnosis that we need, and investigations that are unnecessary and expensive, that over-investigating shotgun approach. So they're clearly looking at these examples, they're clearly looking for targeted, focused choice of investigations, choice of history and examination based on good clinical reasoning principles and showing the seniority of a GP under supervision, not I used the term before, I use it again, the shotgun approach of a junior doctor who isn't quite sure what to leave in and what to leave out. These are just 2 of the competencies, but I think it's pretty clear when we look at the other competencies, the kind of model that they're looking for. So the other thing the college has released is some guides on how candidates can use their 5 minutes reading time. And I really don't think there's anything here that's different to the way we've advised them in the past. They've got a little bit more time now, and because it's a case discussion, they'll probably be talking in a little more depth and detail to the examiners. So I think it's appropriate that they have more time. This is a nice model of the 5 minutes, and I created a video a few years back, maybe year before last, on how to use the 3 minutes in OSCE. I may actually need to refresh that on how best to use the 5 minutes in an RCE. But thinking about who are the people, what are the issues, what are the potential causes, what's the background, what else do I need to know, how would I manage this patient? As you can see, this is higher level thinking than just what are my differentials and what do I need to ask. And I think being prepared for the kind of things that may be inquired about is important. So how can candidates prepare? Well, I think the important thing is the content hasn't changed. The RACGP curriculum is still the curriculum. The patients we see every day is still the same. So practicing all kinds of cases, both from a patient background point of view and the types of cases, the 4 types that are likely to appear in the RCE is important. Obviously, the more practice, the better. Candidates that often fall down because they don't look polished, they're not experienced. They need to be used to that, but also structure and system is really important, showing that they're not haphazard, they've actually got a good structured approach, and having really high quality communication skills. Doing this online is hard. It's harder to be engaging down a camera. I'm trying to be engaging right now, and it is hard. And so they need to be comfortable with the technology. Not only do they need to have good internet connection, have a good microphone, have a good headset. If they are students who are struggling when you are tutoring them, you know the students I'm talking about that can never get their connection working and are always half off the screen. It's important that you encourage them to figure that stuff out now, because that will matter in this exam. But also to know that their communication style is going to be different on Zoom. So they need to learn to look at the camera. They need to make sure they've got good lighting. The other thing that's important is knowing the guidelines.